Hello, welcome everybody. Thanks for joining us today. I know this is a busy time of year. I appreciate you giving up some of your time to be with us. My name is Paul Hartshey. I'm the CEO of RevCycle Partners, and just want to welcome you to our webinar on benefits and eligibility verification. I'd like to thank the RevolutionEHR folks for kind of co-sponsoring this with us and giving us access to you and their customer base. A few logistics before we get started. Everyone's typical webinars, everyone's in muted mode to keep the noise down, and we'll do a Q&A session at the end. So you should see in your GoToWebinar panel a questions area where you can submit questions along the way, and we'll queue them up and do a Q&A at the end. The webinar is being recorded, so if you need to drop off or if you want to forward this to someone else in the office, you'll be getting an email with a link to the recording sometime in the next couple of days. And I think that's it from the logistics. So let's see this. There we go. So today, joining me on the webinar is Cindy Miller. Cindy is our manager of our WeVerify services team. Cindy, you want to give a little background on yourself and
Sure.
what your history is?
Sure, absolutely. Like Paul said, my name's Cindy Miller. I have about 30 years of combined experience with billing and verification and about 10 years with optometry. So I've kind of worked a lot of different specialties, but like I said, the last 10 years, it's been all optometry.
Great, sounds good. And Cindy will be demoing in Revolution later in the webinar, how we interact with Revolution, where we store some of the information, and just kind of how our WeVerify service would look in a RevolutionEHR implementation. So later in the webinar, we'll actually show some stuff there. So let's get started. The topic today is benefits and eligibility verification. Most of you probably know us for our outsourced billing service. That's where we started years ago and where the bulk of our customers are using us. But we also tackle the verification topic through a separate service. We launched that service a couple years ago, right before COVID hit, and obviously that got in the way of a lot of things, but we're growing the service nicely and serving a bunch of RevolutionEHR practices. As we've been out in the market and talking to customers about this topic and serving customers through our WeVerify service, there's a number of kind of recurring themes we hear, realities that practice seem to find themselves in. And I guess generally, and obviously this is different practice to practice, but generally, we see a lot of practices that run into really inconsistencies in gathering their benefits verification information. Maybe a practice will be good at securing the vision benefits and authorizations, but not so much on the medical side. Many will try and grab the insurance information at the time they're scheduling the appointment, but that information may be out of date by the time the patient shows up. The actual success on capturing the data seems to vary quite a bit depending on the busyness of the staff. It's often a shared responsibility, like a lot of things are in optometric practice, shared responsibility between staff members. And so depending on who is doing the task on a day-to-day basis and gathering that verification information, the data captured might be different, or might be have a mixed level of completeness, if you will. Often in the end, we see practices kind of a philosophy we describe as bill it and we'll see
Yeah.
what happens, which
Yes.
and definitely ends up, what's the ramification of that kind of strategy, Cindy, of just kind of
Yeah.
billing and
That's as a matter of fact, we had just as an example, we had an account within the last couple of weeks that on the billing side, their AR was very high, and they've been with us for over a year for verification, and they were just talking about how much their AR had dropped, how much their aging had gone down since they started using WeVerify because they're collecting the correct copay amounts. They know when the deductibles have been met. They know whether that patient truly has the benefit that they've handed you a card for or told you that they have. And they know all of that before the patient comes in. And so it definitely makes a difference in the aging of your account.
Yeah, definitely. So the bill it and see approach is,
Yeah.
puts a lot of pressure on the actual billing, the biller that's chasing that, and causes issues for the patients themselves. So maybe let's define the scope a bit more with respect to what data we're talking about, or what questions you should be looking to answer when you're gathering the eligibility and benefits information. The first and most basic is, is the patient eligible for benefits based on the insurance information they provided? Did the patient give you the right information? Has it changed since your last visit? Is it out of date? Those types of things are the basics. As you're assessing eligibility, you want to assess when they have multiple plans and how those plans interact and what the primary is, and so that billing stuff gets set up properly up front. And Cindy alluded to, a really big one is what are the patient responsibilities? Understanding that prior to when a patient walks in the door allows for much easier conversations, and allows for things like collecting the proper amounts up front. So those copay deductibles, and not just the deductible on their plan, but what their current levels of payment into that deductibles are. What else, Cindy, that are the data that you're trying to gather?
Yeah, I mean, and we're just trying to, a lot of times offices don't know if we're not dealing with maybe somebody that has credentialed a payer as to whether that would be a specialist or a PCP
Hmm.
copay, and we're able to find that information out most of the time. Very seldom have we not been able to find it out. So we know, there's a difference. Maybe it's $50 for specialists, $30 for a PCP. So we know which one that is. So the office is actually charging the right amount to the patient. So after the fact, they're not having to send a bill out after insurance pays and leaves that deductible amount or and copay amount. They're able to collect it right then.
Yeah. Other things that a practice should be, considering and looking at when they're getting this information is what vision benefits may, exist with the patient's medical plans. What vision riders might be there, and knowing that up front, set yourself up for success when the patient is in, and as well as the billing on the back end side.
Mhm.
How about the optical benefits, Cindy? How do those come into play?
Well, when we do the verification with all the vision, there's sometimes that a patient somewhere along the way in a year has gotten an extra frame somewhere, and they're really not eligible, and they come in for that frame benefit and lenses. This way, when we're verifying the benefits, we're getting um, our information is up to date with everything we're
Yeah.
getting. So we know at that minute whether that patient has that benefit available. That way, when the patient gets to the actual optical, then the optometrist or the eye care consultant can actually go ahead and get that order started and get it filled and know what's going to be covered by the patient's insurance.
Yeah. The accurate data for the patient, having the accurate data on benefits
Mhm.
for the patient, just enables those more powerful conversations, more accurate conversations in the dispensary. So
Yeah.
great. So uh, So, with that data, if you invest, either in technology or people or both, and put the time into putting a process in place to get that information up front. The next question is what can you expect from a return? How does this help the practice and the patient when you've got that information up front? Kind of first out of the gate, one of the things to do is potentially adjust your schedule if you determine early enough that a patient's benefits are, they're not eligible based on their current state of their benefits. You could potentially reschedule that appointment for when they will be, which makes your billing easier down the road, and it's helpful to the patient, obviously,
Right.
as well.
Patients are less angry when they leave and know they have a
Right.
benefit than having to pay for something they weren't expecting, and those kinds of things.
Yeah. We talked about understanding all the different plans again, whether it's multiple plans. Maybe you discover or find out that they're on a vision plan that they were not aware of. Might be a spousal plan or something like that, or again, vision benefits on the medical side. We often see medical payers providing a better premium, better reimbursement for some of the basic vision stuff than the VCPs.
Right.
So again, if you can find that information out, you can get the claims. Your biller downstream can get the claims routed to the right payer for the most optimal conclusion for both you and your patients.
Right. And usually if a patient has like a vision rider, say it's a Blue Cross Blue Shield, let's just say they have a benefit of one eye exam per year, and that's available at the time of that patient's appointment, your reimbursement's gonna be higher if you bill it under the medical than it is if you bill it under the vision. And it gives you that option.
Got it. And we talked again, kind of circling back to similar topics, but understanding the accuracy of their current optical benefits, material
Mhm.
benefits, enables strong, good conversations with the patients while they're in your office. So let's talk a little bit about a process. If you want to improve this area, there's some things you can do and look at, whether you're using a service like us or doing it in-house. Um, some of the key steps in building a better process is ensuring that you're able to have enough time to get the benefit, the verification done with enough time before the appointment, with enough time, to react to that, whether that be schedules or finding out that they're not eligible and getting the proper insurance information. Um, we recommend that if you're going to tackle this topic and put some time and effort to improve this area of your practice, that you look at it not just for the vision side, but also the medical payers. It's as important from the downstream billing and patient interaction.
Mhm.
When practices outsource their billing to us, often many of them keep the vision in house. The staff and the practice seems um, generally more comfortable and more experienced with the VCPs, the vision pairs, and the same is true on the verification side. I would think, don't you think, Cindy, that
Mhm.
the
I do.
practices, they just have a lot of experience in the vision side. The staff is exposed to it, and so they're more comfortable on that side, and many of them have that kind of in order,
Right.
but are lacking that level of coverage, exposure, comfort with the medical healthcare payers.
Right.
Um,
And we do, I mean, when we're verifying, these are things that we go over with practices that are, signing up for services, but, we actually verify for medical and vision
mhm.
for all patients. And that way, like, you can have somebody coming in for a comprehensive, and so we're going to say that's their eye exam, so they're going to bill VSP on that, but the patient gets there and it turns into a medical diagnosis, and without worrying if that patient really has a medical benefit, we've already verified it, it's already there for
And with anything that you're, any process that you're looking to improve, in the practice, you want to allocate enough time to get the work done. It doesn't, help to require staff or put expectations on the staff if you don't carve out enough time for them to get that work done and get it done when it needs to be done prior to patients coming in. Ideally, you'd want to track it somehow. Create some KPIs on
you.
key performance indicators. Much like you do in the optical side relative to things like second pair and capture rate. Create some of those types of metrics that you can track on a monthly basis and talk about at staff meetings. Relative to how the team is doing on capturing this information, and then it's also important to focus on the patient communication side of this topic. Make the benefits part of the natural conversation with the patients when they're in your office and in your dispensary. Anything else from a process tips, Cindy?
Well, what I have found over the years, just experience, whether that was I was at a front desk or in optical, patients do not understand their benefits. So they look to you when they come in
Mhm.
for you to know what their benefits are. Um, they just don't understand. Sometimes they don't even know if they have a vision plan. Sometimes they're not versed enough in it to understand. They sign up for it with an employer, but sometimes they really don't know. And it really does make a difference, your rapport with your patients, if the person that they met at the front desk can already help them and understand their insurance policies.
And I guess one last suggestion or tip is there is technology out there to help this topic, right? Often you can get it on the medical side through your clearinghouse. They'll have modules or solutions that you can add on to your clearinghouse package to do the verification side. So if you're looking to do this in-house and have your team enhance how your team is doing it, I would encourage you to look at the technology that's out there to make their job easier and more automated as possible. Or another option is to outsource it. So I would like to kind of shift gears a little bit and talk specifically about what we have developed as our WeVerify service, and kind of goes into some of those details, and then we'll let Cindy show you some things. So as I mentioned, we launched WeVerify as a outsourced verification service about 2 years ago, just before COVID hit. And at a high level, we, much like we do on the billing side, we provide a dedicated resource focused on the verification topic. We're going to verify. Basically, Cindy and her team are monitoring, logging into your RevolutionEHR account and monitoring the schedule and staying at least 2 days in advance in gathering the benefits and verifying the benefits and eligibility and benefits. And as Cindy mentioned before, we do both sides, right? We're going to grab the medical benefits, based on the insurance information of the patient, as well as on the vision side. Let's Cindy kind of go into more details of that. But we're also able to, through technology we use and our team, find vision plans that a patient is not aware they have. So we'll go searching, even if they on the vision side, even if they don't list that as an insurance.
Correct.
So do you want to dig into some of the details we do about, specifically around optometry and some of the stuff that we're grabbing that
Right.
that are.
Yeah, well, like I said a minute ago, like if it's let's just say if somebody has, say, a Blue Cross Blue Shield plan, they don't even know that they have that vision rider on there for an exam, one eye exam per year. And sometimes Cigna's, United Healthcare, something like that, they will also have material benefits. And the patients don't know that. And if it's not been verified, you wouldn't know that. So we're able to grab those benefits that they're sometimes not aware of. And then on the vision side, a lot of times, like I said, a spouse signs up, they they didn't relay it all over. They didn't realize that they both now have two vision plans. So when we do this, we're using like a search engine that kind of crawls through with our information and is able to a lot of times find plans that the patient was not aware, and certainly the office was not aware that they had.
Yeah. And another big aspect, I mean, there's technology we use, but a key component of the service is Cindy's team that is doing the work, and so in addition to gathering that from the payers, that information from the payers, her team we're going to update your PMS, RevolutionEHR, and get that information in the appropriate places, so that you and your staff can access it and utilize it, while the patient's in the office. So we provide really detailed benefits in a consistent and kind of easy to read format, and Cindy will be showing some of that to you. Ultimately, much like similar to how we add value to a practice on the billing side, if you look to outsource this topic, you'll have a dedicated team that's making sure that these things are getting done, same day every day, prior to the patients showing up, and it just frees your staff up to focus on the patients that are in the office, and not this kind of back office work where you're trying to get stuff done before the patient comes in. So it's ultimately it's a resource allocation, and whether your staff has the time to do this work to the level and detail you need, or whether you might want to look at outsourcing it to us, where we can focus on that and get it done for you.
Right.
With,
One
with
thing I'll
Go ahead.
touch on right here is where the update insurance information. One of the big ones is if a patient came in last year and they still had their traditional Medicare, and when they come back this year, they've opted to take one of the Medicare Advantage plans. And sometimes we're able to find that information, and once we do, we update all of that within Revolution for you. We take out the old information, or we deactivate it. We don't remove it, we deactivate it. We put all of the new information in, so when you have an encounter open, you're actually pulling and dragging charges to the correct payer, so it doesn't go out to the old Medicare and wait its 2 weeks or 14 days and then come back denied stating it has an HMO. We already know that before your patient gets there. And we update the EHR with all information that we find. If we find that a patient no longer has the plan that they had last year, we're going to know that. And because we're verified out a couple of days in advance, that gives you a chance to look over that schedule to make sure you're asking that patient for new and current insurance information.
So Cindy, I'm going to hand over the controls to you. So
Okay.
let me know if you've got them.
I got 'em.
There you go. Great. And so, ready to start showing some stuff,
Yep.
Cindy?
Can you see my
Let's just start.
screen?
We can.
Okay.
Let's just start with kind of a basic, display of information. Can you
Okay.
show what it would look like in Revolution? Maybe for a basic medical plan that's been verified, and kind of where people, what it's going to look like, and where people are going to see it.
Sure. We actually work in the schedule area under appointments. If you have more than one location, we're under the location. We're usually looking, day for day. We're looking at all the statuses. And so for this date, I put this in, and this is what my schedule comes up as. This particular patient right here has one insurance. It's a medical plan, and we put all of that information. We use scripts So United Healthcare, we have a script for them. This will show you that the patient does have one per calendar year of a vision exam. One is available. There is no copay when they use it. We know that there's a $25 PCP copay, a $50 specialist copay, and we can tell you that the deductible has been met. If the deductible is not met, we will tell you what the total deductible is and then give you the remaining balance that the patient needs to pay before their benefit's going to be covered. So, this is just a basic, just a basic medical, let's say the patient's coming in for an office visit or, even if they're coming in for an exam. So we're going to make sure that all of this information is filled out correctly. We're going to have the plan names. We're going to enter group numbers anytime we can get that information, which is, most of the time. We're also going to give you, what the copay amounts are. And in this case, this patient would have the specialty copay of the $50. Their total deductible was $500, but they've already met it, so you don't need to worry about that. And, that's how we enter that information here. We also take that same script and we put it under the patient benefit section. And we do put this information in a couple of different places, just so depending on where in the office, the front desk is probably going to be looking in that detail area. The doctor's probably going to be looking under here. Optical is going to be looking, at a different place. So we do enter that information in a couple of different places so it's easy for everyone to get to. And then in this case, we were able to, let's say we were able to verify this and we know this is all correct. We've checked everything. We're actually going to mark this as valid. And once we mark it as valid, if you come over, the shield turns green. So when you're looking at your schedule and you see that shield is green and you hover over it, it'll have that same script information right there. So you can tell that this is ready. You know if this patient came in right now, we have everything we need for them.
Sounds good. How about the vision benefits? Maybe what a VSP patient would look like.
Okay. In this scenario, we have the patient had VSP and they had another insurance, but since the Blue Cross Blue Shield was found to be inactive, we deactivated that and we give them that list here so they'll know we didn't miss it. It's just no longer available. And for vision, we have the whole script here. We list out the copays, the material copays, the retinal screening, what your contact lens fit, amounts are, minimums, maximums, what your contact lens allowances are, your frame. We list all of that out. We let you know whether the patient actually has a diabetic exam that's covered under their vision. Some plans do have it, some do not. And of course, sometimes if that's already a case that you know about, that's probably something that you would bill medically anyway. But we would have it here so if it's covered, we're going to list it right here for you. Same situation. We do everything the exact same. And then when we come in here, we basically are making sure we have all of the correct information in here, who the relationship is, the patient is the policy holder, telling you what the routine exam copay is, material copay, the allowances. We're going to give you the authorization number, the authorization date. As long as all of these things are available for the data service that you have the patient scheduled, all of these will be checked yes. Let's just say, like we were talking before, let's say they're coming in for their exam annually and they've used their frame benefit somewhere along the way, this would be no. And then we would tell you what date that would reset, what date that will actually be available for them. And then also in vision, we actually upload your authorization. And, for VSP, of course, that is this is what their authorization looks like. It tells us that, all of their services are available, even on visions that we don't have to get authorization for, we still give you the upload. So like iMeds, Spectera's, any of those. We're still going to give you all of the paperwork. So this really comes in handy in the optical side, so they can see, because it lists out everything. We're going to give you all the lens enhancements and everything. All
Sounds
that's
good.
there for you. Okay.
So I'm going to remind people that as we're working through some different scenarios, Cindy's showing us some different things, that feel free to add some questions or send us some questions, and we'll get to them at the end of the session. So Cindy, those are the kind of the basic data displays, both from the medical and division side. What happens if you run into something like an exam needing you check the benefits and you see an exam needs a medical referral? What's the process there? How do you guys deal with that?
Okay. So when we're getting that benefit, this patient, of course, in this scenario has Aetna. And when we put the script in, again, we have a script for each payer. It gives all of the information. The routine's not covered. They have vision through their iMed. They have a PCP co-insurance, their deductible, and it tells us right here, it requires referrals for medical visits. Now, we do not actually get the referral or authorization PAs on the medical side, but we're going to list this information for you, and we would also send a task to let you know ahead of time that that patient needs a referral before they're seen on the date you have them scheduled. So that's how we let them know, but we do send a task to whomever in the office, the manager or doctors decide is going to be responsible for looking over the schedule to make sure that somebody's taking care of the referral from the PCP, or that they need an actual authorization. For vision, we get all authorizations that are available.
Sounds good. Through our discussion, we've been talking quite a bit about the optical side and understanding the material benefits. Can you show an example there where kind of lists all that in a little bit more detail?
Let's see what we have here. Let me find what I want.
Daisy Duck.
Not that one. Let's see. You're talking about like right here, Paul?
Yeah.
So it has everything. And again, we plug all this back in on that benefit section under the insurance, just so it's easier. Somebody's looking here, somebody's looking at another area. And, we go ahead and we put the authorization there. And when you're keying the vision claims, it's nice to be able to just, copy that authorization number to get your claim started. What our copays are for our exams. If there's a retinal screening, what the fee for that is. Contact lens fit. Sometimes they're discounts. Sometimes it's a minimum or maximum. What your material copay is, what they're going to pay. And then, if there's, certain frames that you all deal with, then that's going to be listed. If it's a Marchon, it's a $150 allowance, but this patient's not eligible until 1/1/21. Just using this as an example,
Sure.
we would have given you that information. Let's go right here. So we're going to tell you that that frame was not available for today.
Yep.
Okay.
Cool. So Cindy, you showed one point about the kind of the status balls, but maybe talk a little bit about how in the schedule you guys utilize the status balls and the verifications and the and kind of a summary view of how they practice can use that to kind of see what the day looks like.
So if you just go in and you're looking at let's say 2 days from now schedule. Once we've worked through it, everything's gonna, everything that we are verifying for you that we've agreed upon, if that's all of your visits or, or all of the visits that we actually verify for, then you're going to have all of your statuses are going to be, right with what they are. So you're going to know anything that's green, all of this is ready. These patients are ready. When you get to one that has like a red shield, I'm just going to go in and show you. The reason that's red is because this patient had Blue Cross Blue Shield. And so we have found out now that it's not any longer valid. So we're going to deactivate that, but we're still going to we're not going to just deactivate it and not say anything, we're going to let you know that we were unable to verify any benefits. That'll be marked red. So when you're looking
Mhm.
ahead at your schedule, paying attention to these, that's the cue for you right there.
Got it. Sounds good. So maybe one last thing to look at, and then we'll turn to answer some questions that have come in. Is can you highlight? Obviously, we're if somebody signed up for the service, we're going to be doing all this work and providing all this data in the way you show it. But
Mhm,
I'm sure some responsibility stays with the practice. So
mhm.
can you talk a little bit or
Sure,
highlight kind of I guess the data entry requirements?
sure.
What's the practice need to do to make our to allow us to be successful?
Right. Absolutely. So, when if it's a patient that's already been into your office, or if it's a new patient that you've gotten insurance information given to you when they're on a phone call with you, or maybe they've entered it and uploaded a card on a patient portal if you're using that, um, we want to make sure that we have good information. So let's go to, you know, and demographics. You'll want to be really careful. What is the patient's first name? They might call Christopher Toby, and you know that, but insurance doesn't. So always try to put the name that insurance knows the patient by, or what their legal name is. You can put the nickname over here because that's what you refer to them as there. Um, Make sure the date of birth is in there. The last, we like social security numbers to be full, but we also know that patients do not like to give out that information. So if the last four is there, that's all we can see anyway. If you get the last four, that's great. Um, Make sure that, they're connected if they have family members, all of those areas, anything that helps when we're in ahead of time, like the name, like the date of birth, the social security numbers. Look at your policy number on a card if they've given it to you. If it's a Blue Cross Blue Shield and it has a prefix of XYZ or whatever, that XYZ has to be there. A lot of times offices will leave that part off, and depending on the platform that we're using as to whether we can find a benefit when those things are not there. Sometimes they're also looking for um, an O1 or an O2 or an O3, and sometimes we don't think that's important. But if James is the O3 member, sometimes in order to find their benefits, depending again on the platform or portal, we have to have that O3 to know and be able to plug into that information. So as accurate as you can get is what we need in here.
Got it. Sounds good. All right, Cindy, I'm gonna grab. Thank you for just showing all
Uh-huh.
that. I'm gonna
Sure.
grab control back,
Okay.
and one last thing. So just to talk at a high level on pricing, we price the service, the WeVerify service, based on the number of patients verified in a month. So at the end of the month, we'll tally up all the patients that we've taken care of for you and bill you accordingly. It starts at $375 per patient, and then there's some tiered discounts here, based on quantity per month. So that's how that works. And with that, let me switch over and take a look at some questions that are coming in here, Cindy.
Okay.
And between the two of us, maybe we can handle them. So,
Okay. One thing,
uh, oh, go
Paul,
ahead, Cindy. Yeah, sure, sure. Yeah,
I want to say when you're talking about the pricing, and we say that's per patient, let's just say, sometimes patients come in, they have a whole stack of insurance cards. They don't really know if they're still good or if they're really covered on them, or they don't know anything about them. So the per patient is the way it is charged. So if the patient, has 5 insurances, we're going to verify everything that the patient has that you have in Revolution. We're going to verify. We're going to try to find everything we can about all of those plans. It's still only one charge.
got it.
So you're not getting, right. It's
We
per
count
patient.
per patient or per appointment, not
Uh-huh.
per insurance payer. Yeah,
Yes.
but some
Yep.
people get that confused with the medical and vision side.
Yep.
So
Yep.
good clarification. So, all right, a couple of questions here. I use RevCycle for billing. Would my biller do the verification also? Cindy, you want to talk about the
Um,
team?
Absolutely. The WeVerify team is a complete different team, just like your RevCycle team is a whole separate team. I mean, we all work together. We're all one, but they're different departments under different management with different kinds of specialists or billers with that expertise. So your biller for your RevCycle billing would not be the same as your specialist for your WeVerify. So
Got it.
we do work very close with the biller. If they're seeing something that we verified that they're getting back on an EOB, we have that option to be able to talk to them to make sure we're getting 100% of what we need for you all. But it is two separate people. So,
Got it.
you would have a specialist and then you would have a biller.
I'll expand on that or ask a follow-up question. When you assign, how are the accounts or practices covered with your team? Do you have the same person working it every day, or is it rotate? How does that
Right,
work?
right. On my team, we actually have a separate startup team, and the startup team actually starts the brand new accounts that sign up for services. They actually start that, so they actually are on phone calls with me. We're actually going over and showing the offices everything. We're learning about maybe the state that they're in, if there are state plans that have some, different things to them. That startup specialist is going to work that account and build that account until she's going to be the one having the correspondence with the office until she has that account worked exactly like she needs it. So she knows about, let's just say, you have a school up there that has a certain Cigna plan and it includes this but doesn't that. She's going to know all of those things. She's going to build this. And once she's done that, we will then transfer it it'll transition over to a permanent or a primary specialist. And for the most part, we try to keep, because different states have, different things, we try to keep those together. So like if it
Got it.
were New York or Illinois, we kind of have that person, doing that account and maybe another one or something like that. So, but it would be your dedicated specialist, even after the startup. It wouldn't be going to anyone else. The only time would be if for some reason it needed a transition, we would let you know that, or if your specialist was off on, PTO
Vacation or
time or
something.
something
Sure.
like that, and we would let you know that.
Got it. A couple of related questions. Maybe I'll just list them separately. First one is, do you verify all appointments?
We the appointment types that we don't verify for, we don't do any of like LASIK, any of those cataract post-op appointments. So if you're co-managing, because normally, as you know, it's a global charge, and if the patient's Medicare or Blue Cross or whatever their payer was actually paid the surgeon for that cataract surgery, then you're going to be covered under that global. So we don't verify that.
Hmm.
We also don't verify, like if a patient, maybe you schedule patients to come in and to look in optical, maybe they're coming back next week after they had an appointment today. We've already verified that benefit. So if you just reschedule them under a template of, say, optical encounter, we're not going to re-verify that. We're not going to do that. RX checks, things like that, we're not gonna do, because we generally already gotten all those benefits.
Okay, and kind of a related one is, if a patient is booked today at 8:30 a.m. for tomorrow at 3:30 p.m., who would be verifying the insurance? I assume that's relating to the comment that we said we stay 2 days ahead.
2
So
days ahead.
how do we deal with same day, day before type of patients?
Okay. So what we do is we're always going to be, we guarantee you that we're going to be verified out the 2 days ahead. I will tell you that my specialist, let's just say that person gets added on this afternoon. Each morning, the specialist looks to see if there are any add-ons quickly. If there are, they're usually able to grab those, but we don't guarantee. we don't guarantee that. Once we come out of that account, most of the time it's going to be caught same day. It's always going to be up to the office.
Sounds good. Let's see. Here's one question. It's just, how does this compare to ABB Verify? And so I'll take that one. Don't particularly like to talk about other vendor solutions, but I will talk at a high level about ABB Verify because we see them in the market a bunch.
Right.
It is technology, so I guess I would differentiate that, and I would lump in things like your clearinghouse, whether it be TriZetto or Availity, that provides verification technology. Those are technologies that you can purchase, use, and deploy to your team. We are, the best way to think about us is more of an extension of your team itself, right? So we're going to, utilize technology to get that same type of information, but then we're going to, as Cindy showed, put it back into RevolutionEHR, store it there, interact with you guys. If there are things that need to be done or talk to the patient, we'll call payers. So there's a human component, a staff resourcing component that really is at the core of what we're doing, compared to just being a technology solution that your team would use, right? And so that's probably the best way to think about it, is the separation of, if you've got a team that's doing it and doing it well, and you want to make them more efficient, then looking at those technologies probably makes sense. If you're not having the time to get to this topic and it's kind of inconsistent, you can, like any outsourcing topic, you can kind of look to kind of have somebody cover that, and that's what WeVerify is all about. Let's see. Here's a question for you, Cindy. Is your team well versed in Availity and One Health port?
Absolutely. We have lots of fun with One Health port. But yes, One Health, Availity, all of the portals, they're all well versed in that. Again, in the startup process, those are the things that we build on. If there's problems under a payer, if it's problems under a portal, something like that, we discuss all of that up front. And over the first few weeks, we're really working through all of those things to make sure we're all on the same page. But yes, we do, and they are versed in all of those.
Great.
Portals.
Here's one related to our interactions or lack thereof with patients. It says, also, it sounds like your specialist will not communicate any benefits info to the patient, correct? Our staff would need to do all that, it seems.
Okay. That is correct, and that's for a couple of reasons. The patients don't know us, and so, like, let's just say I was calling to see if they could give me that prefix on their on their benefit. They don't know me. They don't know that I'm really calling from your office. We don't have that rapport that you all have with them, and patients don't like to give out that information. So it is always easier for the office that they're used to and the people that they're used to have those conversations with them. And then we're not leaving messages. Sometimes the patient would, call in to say, so-and-so called me and they need my insurance. And so it's just easier, it's safer, and just a whole lot better on the patient.
So, Cindy, let me ask maybe an extension of that, or ask you to talk a little bit about it. Since there is that demarcation, or delineation is probably better, delineation of responsibility, where the practice still has the responsibility of interacting with the patient. Can you talk a little bit about our interaction with the practice? You mentioned it in the demo. Talk about tasking, things like that. Maybe talk or summarize, how we're interacting with a practice that's using our service.
Right. So for anyone using the RevCycle side, it really is like that. But for those that aren't, we can send tasks to, like I said, whoever, the office deems is the person to get that information. We use Rev messaging for all of that information as well. We will schedule phone calls. We will schedule meetings so we can actually screen share. we're always going to be available to do those things. So, you're going to get used to having, one or two people in the beginning working on the account, and then you're one person, and that'll be the person that you converse with, and that'll be through messaging. Sometimes there may be a phone call, there may be a task, something like that. So we just make sure that we're all on the same page. We're also going to put as much information as we can of something we found out in that script that we actually place into Revolution.
Sounds good. Well, thanks, Cindy. I don't see any other questions, and we're going past 50 minutes, so I think we'll
Okay.
call it a wrap. I do have the contact information. Cindy, I forgot to update the slide and put your contact information in there.
Okay.
So it's basically cmiller@RevCycle-Partners if someone wants to reach out to you, or they can
Yep.
reach out to me, and I'll forward it. But anyone
Absolutely.
has any interest in further conversations about this, we can reach us through the normal channels. I said we'll send out a link to the recording, which you're welcome to watch again and forward to your peers, folks in the practice, your staff. And with that, we'll call it a wrap. I just want to thank everybody again for spending some time with us in this busy time of the year. We hope you and your families and your staff have a great holiday season, and thanks again to RevolutionEHR for giving us the opportunity to present to you guys. Thanks, everybody.
Absolutely. Thank you.
Thanks, Cindy.
Mm-hmm.